In this part of the training video, we will review the cleaning and disinfection of the room of a patient or resident who is being isolated from others because of having an infection. The rooms of patients or residents who are being isolated should be cleaned after all other rooms you are assigned to clean are done. This is to reduce any risk of contaminating other rooms and spreading infections to others. There are different types of precautions we take to stay safe in these rooms. Standard precautions, such as good hand hygiene, are actions you take whether a patient or resident has a known infection or not. But when a resident or patient has a known infection and is being isolated, there are more steps to take to stay safe and help prevent the spread of infection. These extra precautions are known as transmission-based precautions. There are 3 types of transmission-based precautions, and the PPE you select and wear will depend on the type of infection the patient or resident has and how that infection is spread. For example, if a patient or resident has Clostridium difficile infection, or C. diff as it is commonly called, you will need to follow contact precautions. Contact precautions are the steps you take to prevent the spread of the infection, which happens by coming in direct contact with the person and by indirect contact in the room. Direct contact would happen if you had direct skin-to-skin contact with the infected person, such as shaking their hand. Indirect contact happens when you touch a surface or object in the room that has also been touched by the infected person and the germs get on your hand. For example, touching the bedside table or a bed rail. Surfaces and objects that are dry and appear to be clean can still have germs on them that cause infection. Please ask the infection preventionist where you work if you want to learn more about transmission-based precautions. Before going into the room of a patient or resident who is in isolation, choose and put on the personal protective equipment you will need, which I will now call PPE. The goal of PPE is to protect you and the patient or resident in the room. Look at the sign posted on the wall outside of the room so you will know the type of isolation that is in place. If you do not understand the sign, ask someone from the nursing staff or your supervisor to help you so that you know the PPE you will need to wear. When you are putting on your PPE, it is important that you put it on in the correct order. To don or put on your PPE, always start by performing hand hygiene. Next, put on your gown and tie it in place. If a gown is a piece of PPE, you will need to remain safe in the care environment. Next, put on your face mask. If this will be a piece of equipment you will need to remain safe in the care environment. Now, put on eye goggles. If this will be a piece of equipment you will need to remain safe in the care environment. Finally, put on gloves. Start by picking up trash items and debris throughout the room and placing it in the trash can. Once this is done, remove the trash liner from the trash can and place the liner at the doorway. Next, collect loose linen throughout the room and restroom. Do not put linen on the floor as you collect it, but place it in the linen hamper or bag. Remove pillowcases slowly. Be careful not to shake or agitate any linens you pick up from the floor or take off of the bed, because this will cause germs to become airborne and pose an infection control risk. While taking the linen from the bed, pull the linen from the corners of the bed and fold the linen upon itself, forming a somewhat self-contained package. When all the linens have been gathered, place the linens in the linen hamper or bag. Remove the linen liner and place it at the doorway next to the trash. In another part of the training video, you will learn how to clean and disinfect high-touch surfaces. Those surfaces that have a high risk of transferring germs because they are touched by many people, many times throughout the day. For now, we will talk about how you will damp wipe all surfaces with the disinfectant. Surfaces that need to be damp wiped include the bed. Be sure to clean the rails on both sides of the bed, the positioning buttons, the call light, and then any other furniture in the room, such as chairs, recliners, tables, or countertops. Once you have damp wiped all of these surfaces and all of the high-touch surfaces, place your used cleaning cloth in the container or bag on your cart. Before cleaning the restroom, get a new cleaning cloth from your cart. In another part of this training video, we will review all of the steps involved in cleaning the patient or resident restroom. Once you have cleaned the restroom, put your used cleaning cloth in the container or bag on your cart. After cleaning the restroom, you need to remove your gloves, do hand hygiene, and put on new, clean gloves. A rule is that when your hands are not visibly dirty, alcohol-based hand rub is the best way for doing hand hygiene in the healthcare setting. But if your hands are visibly dirty, you must use soap and warm water to clean them. Now that the restroom is clean, it is time to restock the paper products and put a new trash liner and linen liner in the room. The last step in cleaning the room is to damp mop the floor in the area where the patient or resident is and in the restroom. To keep the environment safe and help prevent someone from slipping on the wet floor, always start by placing a wet floor sign at the doorway of the room. Be sure to wring the mop head to remove as much solution as you can to lessen drips. After you wring out your mop, or after you have put cleaning solution on a pre-dampened floor cleaner, if this is what is used where you work, start to mop the floor from the edge of the room and work towards the furthest corner of the room away from the door. Just like with dry mopping, you will mop using a figure-8 motion so that the swipes of the mop overlap the entire floor. Make sure to walk your way out of the room by damp mopping as you go, so you do not track dirt from your shoes onto the newly cleaned floor. Keep the wet floor sign in the doorway of the room until the floor is dry and is safe to walk on. After you have cleaned the room, remove your PPE and throw away your gloves. It is also important that when you take off your PPE, you take it off in the correct order. Start by removing your gloves and placing them in the trash. Next, remove your eye goggles. Now, remove your gown and either place it in the dirty linen or place it in the trash if it is not a reusable item. Next, remove your face mask and place it in the trash. Lastly, perform hand hygiene. Know your facility policy about disposal of PPE. Some settings may have disposable PPE, or some may have a container for reusable PPE. Talk with your supervisor about what your facility policy directs you to do with PPE that has been used. Do hand hygiene with an alcohol-based hand rub or soap and water and put on clean gloves. Choose and put on the personal protective equipment you will need. Next, damp wipe any tools that you brought into the room, such as mop sticks. This keeps you safe from touching these items with clean hands and spreading germs throughout the facility.